right? So when you come in, you'll have to find 2 bottles somewhere. You have to have these for checkoff. I don't care if it's a bottle of it. We have bottles, just grab some bottles. There's bottles over there. The reason I need you to do that is because you're going to demonstrate lipping, and you have to know how to do that. Okay? So what we're going to do first, check the physician's orders. I have everything here I need. I'm going to come in, introduce myself to the patient, explain the procedure, provide privacy. I'm going to wash my hands, put gloves on, ID the patient, tell them everything I need to tell them, correct?
Yes.
Okay, so next thing I'm going to do is I'm going to position my patient. Oh, hey, Paula.
Yeah.
I need a stethoscope. So I got a stethoscope. I got this one. I'm not going to put it in my ears, I promise. Alright, so when I come in, I'll put my stethoscope right here. And that way it's easily available for me. So first thing I want to do is I'm going to come in. I've already ID'd the patient. I've already put my gloves on. Well, I'm going to put my gloves on. I'm going to put this patient up in high Fowlers. High Fowlers is really the only way you can do this because you're compromising the airway. Don't do this to your patients. Hang on. That's not nice to your patients, but he's heavy. Okay. Oh my gosh. I hate floppy heads. Okay, so high Fowlers. You guys may have to not, be careful moving these guys up because their head will fold in half and you'll never get in there. You guys see what I'm saying? You see how it's already starting to. So high Fowler's position is what we're going to want to do. Something that's very important, and you will not pass the check off if you don't do this, is that you need to make sure that your suction apparatus is functional and intact. So I'm going to come over here and I'm going to turn on my stuff. This one's not plugged in. Let's see. Plugs. Hopefully I just didn't unplug the bed.
I think we did.
It's the bed, definitely.
Okay. Anyway, there's a switch right here. I told you it was loud. So you'll actually switch it on. That will actually be used on the checkoff, so they'll be plugged in because I need to hear it. So you actually turn it on, and there's a little meter here. You hear that? So it's functional. Okay. So I'm going to have my suction here and readily available. I would actually have a yonker on here just in case I need to suction or anything. Or I would have a yonker at the side if I need to for any extra secretions, but don't put it on. The checkoff sheet tells you that you can dump your fluid into a basin. That's optional if you want to do that. And I'm going to show you how I do it instead of that. Instead of with that. Alright, so I've done everything. Next thing I'm going to do is I'm going to come over here, and you have these sterile suction kits, yes? Okay, so I'm going to open this. I'm going to grab, this is already open, but I'm going to grab it from here. And I'm opening away from myself. Okay. I usually pull this thing off, but because we reuse it, I'm leaving it on there. But I pull it off because it gets in my way. I'm going to take my gloves out here. And move them out. And then this is my saline. Yes? Okay. What's important about saline when you pick it up to use it?
It's sealed.
Check the expiration.
Check the expiration. And if it's already open, you need to see when it was open. These are only good for 24 hours and then they have to get checked. So that's why they come in little things. So I'm going to lip this because I'm going to need some saline in there, yes? So I'm going to palm the label. Palm the label. I'm going to come over here, lip it, okay, like that. So I just lipped some of it, meaning you're pouring the top off basically. So I'm lipping it. I'm going to pour some in there, and then I'm going to come over here and I'm going to pour in there. I'm not reaching over it, I'm not putting in it. Did here, I do there. Everybody with me? Alright, so I'm done with that. Next thing I'm going to do, open up my gloves. Gloves ready. Alright, so patient has to be, you're going to compromise their airway for about 15 to 20 seconds, correct? So we need to do what to our patients before we do that? hyperoxygenate them. So I should have actually set this up when I was already setting my section up. One thing I'll tell you guys is make sure that this is connected to the oxygen source, not just on the floor. Okay, so you're gonna check that, make sure it's on there. Can you put a mask on the trach? No. So you need to know how to use this bamboo bag, meaning you take the mask off, and this actually goes onto the trach. How do you hyperoxygenate? How many breaths? What's the normal breaths per minute? 12 to 20? So if I'm going to hyperoxygenate, what do I want to do?
More than 20.
Give them more than 20. Give them 25, 30 breaths, right? Because we want to hyperoxygenate because I'm getting ready to put that tube in there and suck it out. Okay? So, I have my bamboo bag right here, correct? And I have my suction set up already. Yes? Yes, no?
Yes.
Okay. You can place a drape over them or a towel or whatever in case you get any boogies or whatever when you're doing this. Okay? Let me make sure I didn't miss anything for y'all there. Okay, so everything's open. We got everything set up. Yes?
Yes.
We've checked our orders, done hand hygiene, patient's position. We've already poured our basin. Why would we come in here to suction a trach patient? What is the purpose of suctioning a trach? Just because you're bored and it sounds really cool? Or it's usually because they're building up secretions, yes?
Yeah.
Sometimes you go in there and they've got stuff just draining out. There's usually, would you grab me a drainage dressing? Because he doesn't even have one on here. I'll need that for the next portion too. So I'm going to come in here first thing, and I'm going to put this down first of all because I'm not following it. I'm going to come in here, I'm going to assess my breath sounds, yes? Because I'm going to document that I listened to his breath sounds and that they were what? He needed to be suctioned, yes? Probably check up pulse ox and see what his pulse ox is too. And if the patient asks to be suctioned, and they feel like they can't breathe, then sometimes it's a good idea to do it. So suctioning is usually scheduled for every couple of hours of PRN, however they write the order, okay? So I'll listen to his lungs and he sounds really junky up here. A lot of times they can't get that up, so that's our job to suction it up, okay? Next thing I'm going to do is use this to suction. How many times can I do a pass with that? Meaning, how many times can I suction this patient with that particular kit? Twice. Each kit can be used twice. If you have to go in more than twice, you have to get a new kit, okay? Because that's real fine suctioning and it'll fill up with yucky stuff really quick. So 2 passes and then you have to get a new kit, okay? All right, so we're all ready to go, yes? So I'm gonna put on my sterile gloves. Look at you little booger. Okay, all set? Yes? Can I touch this like this?
Yes.
Can I do this?
No.
Okay, not below your waist, right? Okay, so I'm all set to go. I dumped my saline in here already, right?
Yeah.
Saline lubricates the catheter. That's your lubricant for this. We don't put actual lube. Okay, so your saline lubricates. Can I put my fingers in here?
Yes.
Sterile and sterile, right? Okay. So next thing I'm going to do is I got my catheter out. And these are like Foley's. Y'all better get a hold of these little boogers. Okay? So how I do mine is this is the apparatus that actually is going to connect to your suctioning. Is this hand sterile anymore?
No.
I have to connect this. Can this hand touch over here?
No.
No. So you need to make sure when you get this, you hold it right like that and only connect it. And that's it. Then you better get a hold of this thing because if it does one of these numbers and you hit your sleeve, no bueno. So I come back from here until I get a hold of this and I get a good grip on it and get it positioned however I want it. Okay? So here we go. Can I touch this with this hand? Am I gonna insert this into the patient?
No.
No, that's your control for your suction. When you push down on it, it sucks. When you let off, it doesn't. Okay? So, put my finger on, it's sucking. Letting my finger off, it is not. Does everybody understand that part?
Okay.
Okay, so I'm gonna actually go into the patient's airway. How long can I be in there? 15 seconds max. So you should be counting. I count when I go in. 1, 2, I don't count out loud, I count in my head. But you shouldn't be in there any longer than 15 seconds because their airway's gone when this is in there. So imagine holding your breath for 15 seconds because that's what they're doing. Can I suction when I go in? When I'm inserting, I can intermittently suck.
No, you need to get to a certain point, right?
Okay, so I do not use suction upon insertion, only when I'm coming out. If I start sucking when I'm inserting, what's going to happen? It's going to stick to something, right? So we don't do that, and plus you're going at a downward angle, so you don't want to do that. Suctioning starts once you've hit the what? Your sheet tells you guys, does it not? Okay, so well, you're going through the trachea to go down there, so it's going to the trachea. Do not occlude when inserting. It says in bold letters. Apply suctioning intermittently. All right, so when you're inserting, it doesn't tell you on there. You're going down basically to what's called the carina. And what you'll see in these patients is when you get close to that point, they'll start doing this. You'll see them move like that because you're stimulating a cough effort. So you'll start to see them, their shoulder. So you'll get down there. So 10 to 15 seconds, and that's a round trip. That's not a one way. So you have 10 to 15 going in and coming out. Y'all got that?
So what did we go to though?
It's called
15
carina.
seconds, in and out.
And you'll start to see a motion. Okay?
So we don't put our finger on it until after we're down there.
Right, because if you're, and it tells you do not occlude the Y port upon insertion, because if you do that, it can stick and it can cause issues in there. Okay? Is everybody with me so far? We're good? Okay, so I'm going to go ahead and insert. I'm going to tell the patient what I'm going to do. I'm going to come over here. I got a hold of this. My hand cannot touch that either, just like when we did the catheters. So I'm going to start like this. How many seconds? Okay, so just to tell you guys, in a slow motion, as I'm going in here, I'm not doing any suction. And you can kind of do a twisting motion in there. You want to try not to hit their chin with this and stuff. Is it sterile then? No, and lungs need to be sterile. So be cautious how you're inserting this in. Twisting motion, intermittent twisting coming out, and suctioning, like so. And hold this when it comes out, because if you do one of these numbers, boogers fly everywhere, or it hits the patient's gown. You have to control this catheter, especially this because it's sterile. So 10 to 15 seconds going in. I'll pull that. There we go. 10 to 15 seconds going in, and you can use a rotating thing here. When you're coming out, it's intermittent suction and rotating. And I just pull it up. Any questions about that part? No? Yes? Maybe?
How do you know when you get to the point at which you don't want to go?
You'll start to feel, you'll feel a little bit of resistance, and that's when you'll see the patient start to, you'll start to stimulate that cough reflex. You'll see it. And once you feel resistance, you don't push past that. So if you do feel resistance, don't push past it. Now, I've already suctioned him, so I'm going to come over here, and I've got saline in here, right? Okay, so I'm going to go ahead and suction saline in here, and I'm not doing it to make sure it works, because I've already assessed that. I'm doing it to clear it out. So I'm cleaning this out with sterile suctioning, or sterile saline, sorry. Next thing I'm going to do is I'm going to take this, and I'm going to wrap it around here, because this is still sterile, right? And I'm going to put these in my ears. This isn't mine, so I'm not going to put them in my ears. And I'm going to come back over here, and I'm going to reassess. We're assessing anterior lung sounds. If the patient will sit up, you can listen to posterior, but this is going to give you a pretty good idea if he's cleared or not. So I'm going to reassess all my lung sounds, yes? Okay, now you may be told he sounds junky again. You need to do another pass. Or the instructor might say, okay, everything's clear, you're done. So if he's junky again, I'm going to basically repeat, meaning I'm going to come back over here. I'm going to get everything ready again. I usually just stick it back in saline right before I go. Yes? Okay, then I have to come back over here. I have to hyperoxygenate, just like I told you. You have to do 30 breaths. So hyperoxygenate him, and it actually has to. You guys need to be familiar with how to put this on, but I'm not going to fail you if you can't get it on, because his chin's a little floppier than normal. So it goes on the trach, and you'll just tell me, you know, show me you get on there, show me you do 30 breaths. Please, you don't have to do the whole 30, but you need to be able to tell me and demonstrate you can do it. Okay? This should be done right before this procedure. Don't do it while you're prepping and then go, because he's already used up all that oxygen. So I'm done hyperoxygenating, and y'all don't do these. You'll pull his trach out of his throat, okay? So what you have to do is just get it on there, get it on, hyperoxygenate, and then I usually reach down and pull to separate it to come off. You can't just yank them, so it has to be delicate. I have my ambu bag there, so now I would come over here and go ahead and make my pass again, 10 to 15 seconds. Okay, so I'm done. I've already done that again. I'm not gonna rinse this out because I've already done 2 passes, right?
Mm-hmm.
But I am gonna go ahead and come back over here and reassess his lung sounds, because that's checking for effectiveness. Okay, so he sounds good. So now I'm gonna go ahead. I'm gonna take this off. It goes, you know, in through the glove thing again, and I'm gonna pull it over and throw it out. Okay, so any questions about that? Then I'm gonna go ahead and position the patient, make sure he's comfortable. I would document my procedure, making sure it's sterile or aseptic technique. Patient tolerated it. I'm gonna document lung sounds pre and post suctioning. So I'm gonna put in there patient's lungs, maybe had bilateral crackles anteriorly to lower lobes, or however I'm going to do that. So I would document that, and then when I'm done, I would say post-suctioning, lung sounds clear all throughout, or what the improvement was, because that's evaluating your intervention. So you have to document a pre and a post, yes? You can document them at the same time when you're done.
Where you would have to do it again?
And you'll document your passes, yeah, how many you did.
But sometimes you have to get another one?
If you have to suction them more than twice, that kit's only good for 2 passes, so you'd have to get a whole nother kit.
Okay, but
Very rarely do you have to do that, unless they're really, unless somebody wasn't suctioning them prior to you, or all of a sudden they just really are creating a lot of secretions, or something's going bad. So, and just so you know, you guys are not the only ones that can suction, but most facilities have respiratory therapists that can help you with this. Sometimes you get really good respiratory therapists that are really good about it, and sometimes you get respiratory therapists that say, well, why do I have to do your job? Well, sorry, you have to put your donut down, but it's your job too. So a lot of times you'll see that if you're pulling a cath and you're starting a cardizem drip, or you have something going on, you need to call the RT and let him come up and help you out, because they're trained to do that. They can suction too. Okay, so that's one of your resources when we talk about suctioning. Any questions? No? Okay.
So the 2 liquids that we grabbed was the saline, correct?
Yeah, that's, and I'm getting ready to get in that when we get into care. That's saline, and this is hydrogen peroxide. It's actually the blood we use for the thing, but we'll pretend. Hydrogen peroxide is not red. So you're going to check your orders, hand hygiene. You're going to position your patient, put all your stuff there. You have to assess your respiratory status, because you have to have a valid reason why you're doing this. You can't do it just for fun. So respiratory status is what's going to be indicative of that. Then you're going to prep all your stuff. So when you're over here, again, remember you have to prep your suctioning and get your tube over here, because you don't want to leave your tube over there, right? So you need to lay it down beside your patient right here. And then prep your ambu bag, making sure it's connected to your oxygen source and that it works. And the oxygen has to be turned on. You can't just connect it to the Christmas tree thing. We call them Christmas trees. You can't connect it to that and say, okay, I'm hooked up. It has to be on. That's what fills this bag. Okay, so make sure your oxygen's connected and then it's turned on, so you can hyperoxygenate, and then I put it just right here so I can get ready. Okay, so I have my ambu bag and my suctioning all right there, correct?
Yeah. So
And
even if the doctor's order says to suction him every 2 hours, if you listen to lung sounds and the lungs are clear, would you not suction him that second hour?
If you have a doctor's orders and he wants it done every 2 hours, then you can do it every 2 hours. But
Clear
the
or
thing
not?
is,
Even if the lungs are clear.
I mean, if he's just wanting to get sick, because they'll build up secretion. So, I mean, it depends on the patient.
Okay.
You may hear it up in here, you may hear it rattling up in the upper airway, and you can just do it. So sometimes the lungs will sound good, but it's going to sound nasty in here because all that's sitting in there, and that happens with a lot of them.
Okay.
So, I mean, you can listen, you'll be listening up here on your lung sounds anyway, so you'll hear that moving around, and you just document it in the upper airway. So you're going to, yeah, you'll want to do it
And it won't hurt them to do it.
It won't hurt them
Okay.
to suction.
I think that's what you were thinking of.
Yeah.
It's not gonna hurt them,
It
but
won't hurt them to do it.
yeah. I mean, the more you suction them, the more you risk introducing bacteria. But the less you suction them, the more you risk them aspirating or getting other issues from it. So we'll listen to them. We have all this. You're listening here. You have everything set up, and you'll set your patient up. And then that's when you're going to come over here and you're going to open up your sterile stuff and you're going to lift your saline and dump it into this container. And this inside of this container and everything in it is all sterile. So you can stick your little fingers in there if you want and move it, but that's sterile. Okay? So once we do that, then you're going to come over and you're going to position everything in there. And that means you're going to connect this to that with your non-dominant hand, and your dominant hand will hold the catheter, and that's what's going to control your sterile portion. Okay? And then no occluding going in, 10 to 15 seconds coming out with intermittent suction and twisting. You can kind of twist it a little bit and that'll help. Okay? And then once you're done with that, come rinse it, reassess your lung sounds, and see if you need to go around 2 or not. If not, you dispose of it. If you do, then you hyperoxygenate again and redo your procedure. Hyperoxygenation with the ambu bag is done right before you go in with the catheter. I've had students before say, yeah, I'm going to prep all this. I got this prep. Then they come over here and they lift their fluid and all that stuff, and I'm like, that air was gone a long time ago. He sucked all that up. So it should be done right before. And it's kind of tricky because, you know, that's the part that holds this and connects it, but then you just let go of that because this hand's holding up the catheter and you just hyperoxygenate. And it's going to be hard for y'all to really do these, so you'll just kind of know where to do it. But know this, if you come in and there's a mask on here, and I've had students do this, and we'll do it, we'll put the mask on. If you take the mask and put it over this, I'm going to fail you because a mask is not going to hyperoxygenate a trach. Masks are for mouths. Is it going to do you any good? I've had students come in and put the mask on their mouth. Can you hyperoxygenate a patient with a trach through their mouth? No, because that's why they have a trach. So be cautious and know how to do that. I won't probably make you connect that because their chins are squishy and they fold down and it's just too big of a pain. This is usually on after somebody's done the dressing change or the trach care on here. So these will actually be on here like that. Okay. So what I usually do is I usually take this, move this over, and get trach care out. Oh, it's wound care. Okay. All right. So what I do is with this, I cut a step out of trach care. So I just disconnected this, yes, from my patient. I finished suctioning. So I'm going to put it like this. And then when y'all take these gloves off, I've been watching some of you guys need to be pulling it from the contaminated side, not from the inside and touching you with that. This is a contaminated glove. Would you reach inside your glove and pull? No. So you should be pulling from here and pulling it down and over, like that. This glove, you pull from the inside so you don't touch the outside. Do y'all see what I'm saying? So I get rid of this. I'm going to throw that over. And what I do is I go ahead and reach up here and take that dressing off because it's crusty and dirty and I've saturated it, so I'm getting rid of it. And then I go ahead and take this glove off. Done, okay? So that gets rid of the step right here that says don clean gloves and remove soiled stoma and discard. So it basically eliminates that. If you forget to do it, then you would have to use that step, but I just get rid of it there. All right, so I'm done with all my stuff here. I guess I'll use these crusty gloves here.
I got another pair here for you if
Do
you
you?
want.
Yeah, I forgot to grab 2. All right. Okay. You guys are lucky because we don't use, well, I don't make you guys use the trach ties that are in here. Students used to have used trach ties before, and you'd have to cut and clip and tie them all, and they're a pain in the rump. We don't use them. We use posies. So these are little posy foam ties. It's not like a posy vest where we restrain patients. It just holds in the trach. Okay? So I'll just show you. He's actually got one on, and I'm hoping this one will fit. I don't know what size he's got on, but this is one of the only ones that was up. It might fit. It's a small, so we'll see. But this is the posy, so you'll need one of these. And did you guys get these in your kits? Probably not. So we'll get some out that day for you guys to use because you're gonna check off with these. Okay. So I've got all my stuff. For this procedure, because you're gonna go straight from suctioning into the care, you would already have checked the orders and everything for all this, so you don't have to tell me that you're gonna provide privacy and put the patient in high fat, you've already got them positioned, you're ready to go. So you can skip that part we've already gotten here. So next thing is we're gonna prep our kit and put on our gloves. So what I'm gonna do there is get my kit out here. Again, open away, like so. And I usually, I have to pull this off, so sorry. I can't have that on there. Okay, here's my little crusty gloves. I don't need those. Well, actually, I could use them, but. Alright, so my next thing I'm going to do is I'm going to go ahead. And I can touch this, can't I? Is it sterile here? No? Okay. Alright, so my kit's prepped. One of these, and you'll need to tell me which one is which. So one of them is saline and one of them is hydrogen peroxide. Okay? Everybody understand that? They both have to be lipped. You guys remember that, and you'll lip them into the trash can. And so we're opened up. Let's see. And what you'll want to do, if you use this thing, and this is sometimes how I do this, and it depends on how you want to do this. We have to put the stuff in here, and you have to get a hand that you're going to have clean and a hand that you're not going to have clean. Yes? Because you'll have one that touches everything and one that doesn't. Is everybody, yeah? Okay. So what I go ahead and do is I put on my sterile gloves. And you can bring extra sterile gloves. If you have to change your gloves in the middle and you bring extra ones, I don't care. So I'm putting on my sterile gloves. I love these sterile gloves. They fit so snug, they don't feel like trash bags on my hands. Alright, so I'm sterile, yes? Alright, so now what I'm going to do is I'm going to take this out. And this is my drape. So this is going to extend my sterile field. Okay? So I'm going to lay my drape out here. Yes? Okay? So this is the tie from Florence Nightingale. She used to use that. We don't use those. So we get rid of that. And I separate my stuff out here. So you remember this one? That's the final dressing. Yes, I put it over here. This is a dressing for excess fluid. When we're cleaning, we have some excess fluid on there. And then all of these little things here are what we use to clean with. Okay? So I kind of spread those out on here. I personally do not use this brush. And the reason I do not is because sometimes when you use this, it's like a toothbrush. So when you pull it out of the trach, it flicks stuff. And I don't like booger stuff on me. So I don't use this. If I use this, I may use it on the outer part of the cannula to clean that off, but I do not stick it in and pull it out. If you do that, you're going to get sprayed with booger water. I'm just telling you now.
You can have a face shield on.
Yeah.
To do that.
So be careful with that. These Q-tips we use towards the end to put that in, and then we also use the Q-tips to clean. So I just lay those out, everything kind of out in order of what I use. Pipe cleaners, which is what these are. This is what I like to use on the inside to clean it because it doesn't flick stuff, and they have little bristles, and you can clean the inside really good with these without flicking booger water on you. So I like those. Okay. So next thing I'm going to do is I have to lip those fluids, correct? Okay. So my hand's no longer sterile, is it? So I'm going to palm this is going to be my saline. I'm going to palm it. I'm going to come over here. I'm going to palm and lip it. And then I'm going to put saline in the big one. I'm going to put saline in the little one. I'm going to put saline in this one. So saline goes in all three of those. Okay? Same thing with this one. You can't really palm the labels all the way around, but I'm going to lip that. And this is hydrogen peroxide, so it's important to remember which one you put your hydrogen peroxide in. So for me, I always pick the medium, and I put hydrogen peroxide, half and half in there. Okay? Know your facility policy about using the hydrogen peroxide because some facilities don't use it any longer. Or some do a half strength like what I just did, half and half, so it just depends. So is this hand still sterile?
Yes.
Okay. So next thing I'm going to do is I'm going to reach over here because this hand isn't sterile anymore, is it? No?
No, because you touched the.
Can I touch this right here with this hand?
Yeah.
Okay. Why? Is this sterile? Is he
No.
sterile? No. Okay. And this, so I'm going to pull the inner cannula out. This is one of the older ones. It does not have the, that guy over there has a clicker on it, kind of where you have to pinch the sides to pull out. This guy, you kind of have to just pull it. Does he have he has the clicker one over there, I think.
He didn't have anything in there.
One of them. So you're going to pull straight out like this.
Oh, this one has a clicker.
He has the clicker. He would probably be the better one then for them to check off with. You can see where this has been hard to get in because it's bent on the side. So I'm going to take this out, okay? And I'm going to come over here, and the first thing I'm going to do with this is stick it, and I'm going to kind of soak it into this.
And the peroxide.
With the peroxide. Okay? So I'm going to put it in here. I'm going to soak it. You get it in there real good. Okay? Get all the booger stuff off. Whatever you need to do, let it soak. Okay? What I'm going to do now is I'm going to reach over here, and I'm going to get my pipe cleaner. And I'm going to lift this up, and I try to keep it right above where the one I'm using, because I don't want it to get in the other compartments, right? So I'm going to keep it right here. If I have to adjust it, and you just kind of put this in. This hand over here needs to stay sterile, so make sure you don't touch it. The booger. Okay, we'll try that again. All right. So I have this one right here. You guys have to bend these up. And then put it in here. And this is the one I said I use in here. And this is if there's any dried, because you'll see dried boogers in here, guys. And I just go back and forth. This hand cannot touch this, okay? You don't want to be touching stuff. So I'm going to do this, take this out, I'm done. Get rid of that. And then what I do is I just put it in this hydrogen peroxide mix one more time and just get it really good. If I don't get all the boogers off on the outside, then you can come over here and you can use this one. And like I said, I only use that on the outside. Because if I do this, I'll show you. If I stick this in with the water, and you may not even be able to get in. This one, these don't do this, first of all, okay? The trachs are stable. This is an old broke trach, so you can't do this with your trachs. So that's what's making it hard, but
I'll show him this one over here. When
yeah,
he's done.
okay, in real world, if it was where it was supposed to be and I stuck it in like that, it goes in, and when I pull it out, all that stuff flicks off. So that's why I don't use that. Only on the outside. So I'm done cleaning it, it's all clean. I'm gonna go in here, you need to tap on the side, on the inner side of it, because that's sterile. Tap it, and then I come over here, or you can use the big one. I come over here and I rinse it in the saline. You want to get that hydrogen peroxide out of there, so rinse it really well in there. Tap, tap. You have to get all the water out, because what water you don't get out of this and you put back into their neck goes where? Into their lungs. So you need to tap and get all that extra water out. Tap it, 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 and then we can place it back. Okay? So you're going to place it back in, and this is going to be hard because this one's broke. And I'm going to place it back in. And it's hard with his little chin that's in the way. It's already so it's going to go in, and then you'll feel it click, or you'll hear a click. That one has a clicker, and that probably should be the other one you should check off. This doesn't have a clicker. So it's clicked on there, we're good to go. Is my hand still sterile?
Yes.
Okay. So next thing I'm going to do is I'm going to come over here, and I'm going to take this little Q-tip here, and I'm not going to use the big one because I've already used it, and I'm not going to use the hydrogen peroxide, am I?
No.
No. So what I'm going to do, can I touch it with this?
Yes.
Okay. So I'm just going to turn this over here. I'm going to use my little one
Small one.
and get saline on there, and I'm going to come over here and I'm going to clean. And how you're going to clean, and it's hard to do it on these guys, but regular patients, is you're going to clean one over the top, and you're going to throw it away, and you're going to take this one and dip it, and you're going to clean one on the bottom. So it's a 180 and a 180, and then throw it away. Okay? If you want to use that other one for extra stuff, you can do that. But that usually gets most of the stuff off. Then I go ahead and take this, and I dab it up like this so that my hands aren't really touching them, just the gauze. And I go here, and I soak up any excess anything. So that's all soaked up if there's any excess saline or whatever. Okay, so I'm done with that. Any questions so far? All right, so next thing, I have to switch out my my posies. Where'd my posy go?
It's over here. Got it.
All right, thank you. So the posy isn't sterile, right?
Okay.
Are we worried about the posy being sterile? It's not sterile because it's going to gonna go on their neck. So I'm gonna put that on. The inner cannule's already been put in. We've already cleaned. Placer changed. This has them changing the dressing before they change the tie. I just hope it doesn't slide on them. They'll pull it out. Am I still sterile here?
Yes.
Okay. So next thing I'm going to do is I'm going to take this, which is a sterile dressing, and I'm going to put it onto the patient. Okay. This guy has a weird neck, so it's going to be hard. If normal people are sitting up, this is a very easy process, but these people are not. So I'm just going to put it directly onto the patient, open it up, directly onto the patient. Okay? It's the